Good afternoon and welcome to today's webinar. My name is Becky Slack. I'm one of the External Affairs Managers at the National Housing Federation, and I also have the national lead on member engagement around supported housing and homelessness. So today we're going to be discussing strategies to support mental health. Throughout our conversations with members during the pandemic, the issue of increasing mental health issues and associated social isolation to staff and customers has been a key priority and area of concern, and it continues to be as lockdown continues, and also the uncertainty once vaccination programmes have ended. We've heard some great examples from how our members are dealing with this issue, and today we want to showcase some of those approaches at both the local and also a national level, looking at some of the solutions. So our panel today is Pippa Foster. Pippa is Head of Care and Support at Nottingham Community Housing Association, and Pippa's going to be talking about some of the strategies they've developed for their staff. We've also got Debbie Stewart, who's Director of Wellbeing and Safeguarding at Grand Union Housing Group. Debbie will give us an overview of the strategies they've adopted for their customers during the pandemic. And last but not least, we've got Drew Van Dorn, who's the CEO at HACT. Drew's going to be looking at strategies in the broader context of working with the NHS at a national level and moving towards improving systems for integrated care. We've also got support from James and Cam from the Fed, who are making the whole process smooth in terms of the digital side of it, in case of anything goes wrong. If this is your first GoToWebinar, here's a few things to look out for and fix your on your dashboard. You can close the panel using the red arrow so you can see more speakers and presentation. If you do have issues with sound check, the audio tab. The presentations will last about half an hour. Each speaker will talk about 10 minutes, but feel free to ask questions throughout the webinar. You can do this in the question tab in your GoToWebinar dashboard. And we'll be taking questions during the webinar and the presentations, and we'll try and get to as many questions as possible at the end of the presentations. But do note that we're only going to be able to answer questions that were sent during the presentation and not after it. It's also worth noting, so you don't have to scribble down too many notes, that we'll be sending all attendees an email over the next week or so, which will include a link to a recording of this webinar. The slides from today's session will also be available to download. So without further ado, I'm going to hand you over to our first speaker. Thank you, Pippa.
Hi everybody, I'm Pippa and I work for NCHA, which is East Midlands Housing Association, and we deliver care and support as well as affordable and social housing. This is me at the early stage of lockdown of the pandemic, looking slightly manic while propping up my laptop on a shoebox in the kitchen. The photo was for a campaign to connect colleagues across the organisation and to show how just unusual our worlds had become. In the beginning, I was fired up. My sympathetic nervous system was on fight and flight. I was switched on. I had lots of adrenaline and cortisol, which meant I had an abundance of energy to tackle the pandemic. But this state is meant to be a short-lived response to a crisis. And nearly a year on, I'm really mindful of the physical and psychological impact of stress on the body and mind. And there's a growing body of evidence of mental health as a result of COVID, and particularly on individuals, and key workers are one of those. So that means you and me and our colleagues. And we know that stress impacts performance, and a long-term stress can lead to burnout and breakdowns. And this is what we want to avoid for you, for me, and all of our colleagues. Like all of us, we had an emergency response team looking at government guidance and all the logistics and all the complicated guidance that was being delivered. But for us, it was equally as important to be connecting with each other, to talking about our story, what was happening across the whole of the organisation, because we're a massively diverse workforce in housing associations. We also had a real focus on wellbeing. We had lots of things all over our intranet, but they were difficult to find. So we had a focus and put things together in a wellbeing toolkit. Lots and lots of quick links and a space for managers, because for some people it's easy to talk about mental health and for others it's less. We developed a number of resources, for example, this going home checklist, which is great for our care and support colleagues to kind of leave the stuff at the project and be able to go home. And we reminded our colleagues of our existing employee assistance programs that they could access counselling, they could access lots of things. And perhaps a little optimistically, we started thinking about getting back to a new normal, and we set up 3 groups. One of them was workforce wellbeing. We really identified that people were having very different experiences. And we needed to do an action plan. We needed to really support people in all of the different things that they were doing. So we reviewed our pulse survey, and people told us they were homeschooling, they were lonely, they were living on their own, all sorts of things were happening to them. And we needed to be able to tap in and connect with them. And we reviewed our senior managers' lessons learned reports to see what we could tease out to support our colleagues. And we reviewed the resources. My goodness, there are some wonderful, wonderful resources out there, but there are millions of them. And I don't know about you, but I found it very overwhelming to know where to go to. So we went to some really good campaigns that were already tapped into, like the Time to Change campaign. And we set up some time to talk sessions. These were virtual groups with no more than 5 people who could come in and talk about how they were doing. While it wasn't a therapy session, it was incredibly therapeutic. And members of the wellbeing team, we facilitated those. And these were really helpful and positive for people. We also encouraged people to set up Teams groups and just chat. In our pulse survey, people really miss that, I guess they call it a water cooler moment. Just having a bit of a nonsense about a gig you went to, or music, or what you had for dinner, or what's going on telly. So we encouraged people to set these groups up. And this was all captured within a communication plan. We wanted people to share, to be connected, to reflect on what was happening to them, and to talk about things that were going really well, but also for things that were a bit more challenging. Many of us senior managers wrote blogs about how we really felt. And our Facebook page has been a real winner. Hundreds of people are signed up to this, and they're sharing stories about the good things that are happening, lovely photos, and really getting this essence of what's going on for you, me, and how we can connect together as a team. So we also did top tips helping managers to link up to talking to some of their teams, and we signed up to the Time to Talk campaign. So we looked at all of our teams across the whole of the organisation, and we wanted to map out what people are seeing and what they're experiencing. So we did a list of all the different job roles across the organisation and thought about emotional, financial and practical things that people might be experiencing. We put them here in a list for managers to look at so they can have a think about what their teams might be experiencing. And we've consolidated this into a single document for colleagues, so they can look at the different various impacts that they might be feeling and have a look at the field next to it. And there is a link to every single one of them. So if you're feeling isolated or lonely, or if you're having problems with your finances or whatever, we've got these really handy links for everybody. We have 800 people working across care and support, and we cannot tap into every single one of them, even though I'd love to. But actually, what we've done is tap into our project managers and set up a wellbeing programme that's a 6-month programme for them. I've set them up in peer support groups with people they don't normally work with, led by a senior manager that isn't their line manager. We've sent them out a pandemic resilience test for them to do, and this will give them an individualised score about how they're doing, how they're coping, and also some top tips that they can do to get their resilience increased and to kind of minimise their stress. And they'll look at these in their monthly meetings in their peer groups. They'll also look at these with their line managers and develop a wellbeing action plan, really thinking about reflective practice and what they can do to support themselves and support their teams. We're putting on resilience training sessions from an external provider in a couple of months for people to access. And I sent everybody a card and a gift. And although it was a small gesture, it had a huge impact. And I've had some really quite remarkable and honest emails and communications back from our managers. One of the tools we've got for our managers is a top 10 list for people in care and support. and a space for them to talk about their helpful links, whether it's mindfulness or anything that's helping them. And a space here for reflections. We know that when you write things down, and particularly if it's been traumatic or difficult and challenging, and we know it has been, it really helps you to make sense of it and put it into your own words, and it can be incredibly therapeutic. This isn't going away, and it's tough. It's tough on all of us. And so I've made it a real point that workforce wellbeing is taken seriously at NCHA, and I'm delighted that our board agrees with this. So we have a corporate project. As I was writing the project initiation document and all the campaigns and various things that we could do, I felt overwhelmed about this being a massive task. So I wrote a business case for a wellbeing manager. And I'm delighted that we are interviewing for this this week on Thursday and Friday, which is really going to help us embed this as a core piece of our delivery for all of our workforce. It's got to be a real and authentic thing that we're doing. But what can we do individually? I absolutely love Dr. Brené Brown. Some of you may know who she is, and she talks about the importance of vulnerable leadership. Being okay to not be okay, to talk about it. We don't have to have a big, strong front. We can be human and real and vulnerable as leaders. And actually, it's a really good thing to role model. It's really good to talk about how you're feeling, asking for what you need, and having hard conversations. So I'm committing to do that. Also, having a self-care routine. At the beginning of lockdown, I found open water swimming, which was just fantastic. I don't have a wetsuit, so I'm not brave enough to do it at the moment, but I am following the Wim Hof method and having cold showers in the morning. Things that also help me, I love a cocktail and a kitchen disco, but I also like to go running and do yoga and hang out with my dog. And these things are all really important. So tomorrow is the Time to Talk day, and the theme is the power of small, having a small conversation about mental health. So invite you to dare greatly and be vulnerable. Talk about how you're feeling to a colleague, because you never know what magic might happen. Thank you. So I'm going to hand over to Debbie now, who is going to talk to you about supporting customers with mental health through the pandemic.
Good afternoon. I'm going to talk to you about our journey supporting customers. Just under slightly a year now, isn't it, since we went into our first lockdown. So Grand Union Housing provides just over 12,000 homes. We're based in Milton Keynes, and a quarter of our business is around supporting people in supported housing, alongside more general accommodation, as well as market rent and shared ownership. So community investment is very much about being out and about in the community, and so we had to stop and think, so how can we provide our services to our customers and check on their well-being? Our youth worker has continued to work with our younger customers throughout the pandemic, and we've followed the National Youth Agency guidelines when working with people in the community. So we've worked in one-to-one sessions, as well as having groups of up to 15 in smaller settings than we would do normally. We've had some opportunities to work with some of our older customers, having a VJ celebration day. We did some cooking, we did some demos, and people got to eat the food at the end of it, and they were well received in the summer of last year. We also put some activity packs together for our more older and vulnerable customers, some mindfulness colouring, and some other bits and pieces to keep people occupied. We've done some virtual cookery classes, and they've gone down well, as well as make phone calls to over 1,500 customers in the over 70s category. We've also done employment work still through the pandemic, and we've used the Zoom platform, as well as walking and talking to customers to support them into new employment opportunities. So our wellbeing and support service, that's traditionally been about tenancy support and supporting our more general needs customers. So that work has continued, albeit we've had to use a different platform to support. So we've used Zoom, we've used WhatsApp, we've gone online to talk to customers, and we've spent a lot of time also talking to people over the telephone, helping them to deal with whatever situation they're faced with at the time. We found that we've got more customers hoarding than perhaps we thought we would. So we've worked to still provide skips and support those customers to help clear a backlog of stuff that they've had in their properties. We've worked with other agencies through this period. We've also done financial wellbeing checks, maximise people's income to make sure they're getting all the right level of benefits. And in the first 9 months of this financial year, we actually gained over £3 million in income for our customers. We've also referred on to counselling, some mental health agencies to make sure that people are picked up early doors rather than when they're actually in crisis. We've been doing some projects with Mind in Milton Keynes, working around some hoarding projects, which has involved using the Zoom platform, as well as working with a clinical counsellor and cognitive behaviour therapy. So there's been a lot going on, and the team are really, really busy. I just wanted to tell you about Rachel's story. So Rachel lived with her 2 sons, both 11 and 2. The eldest had had 13 open heart surgeries in the 11 years of his existence. The mum was living with depression, anxiety and PTSD, and the son's mental health was affected by his condition. They lived in a small 2-bedroom property in a very rural location, and their rent arrears were high due to the mum's abusive relationship. So we supported them with a discretionary housing payment. We fast-tracked their housing application, and we moved them to be nearer their family and friends. And the feedback that we've had from the mum is that it was absolutely life-changing, and that the son is now able to have a more normal existence and meet up with his friends when we're not in lockdown, obviously. But I think for the whole family, just that move to be nearer and connected to family has really made a difference. In October last year, we set up a dedicated domestic abuse and safeguarding team, and they support internal colleagues. So they're the go-to people in the organisation when we've got some concerns about a customer, but they're also there to support women and their children and men fleeing domestic abuse. We've set up a safe space on our website, and we've also installed the Bright Sky app and doing some promotion around that. But we've also had colleagues across the association knitting blankets and toys for the women in the refuge. So that's gone down really, really well. Our specialist housing, so that's for people living with learning disabilities, has been really challenging. A lot of the care providers through the first lockdown actually put the schemes into lockdown, so we were only able to provide emergency repairs. So we had to think, well, how can we maintain our relationship with those customers? So we were doing virtual visits. We did some Zoom calls, so talking to a group of customers in the communal lounges of schemes, maintaining regular contacts with the care providers, and generally supporting people through what has been a very isolating experience. So our main aim has been to try and keep customers' spirits up, and they look forward to our staff making those calls. Our dementia and extra care schemes have obviously had to keep running. We've had staff on site during that period, which has been really important. So they work in a collaborative way with the care providers who are there 24/7. We did some tea and biscuits on us. So we sent tea and biscuits to our customers. We maintained regular hot meals, so people living in extra care still got their delicious hot meals every day, and they were delivered to their front door. We supported positive bubbles so that people could still have family members that were in their support bubble visit them. And we've also provided online quizzes and sent the answers through the post a few days later. So our Life 24 service is a visiting service. We provide telecare solutions to all of the customers coming through. So we have existing customers as well as customers that come to us through a contract that we run for Beds Borough Council. So we've had to continue to go to those customers' properties, install equipment, and we've had to make sure that staff have got the right PPE to be able to do that. Assessments and reviews we've done as much as we can over the telephone, but if there's problems with the equipment, then we are sending staff to those properties to support those households. We've got Leanne and Harley here. Leanna, so the mum suffers with epilepsy, so the equipment that we've installed here enables her young daughter to be able to call for help when needed. So that has all happened through the pandemic. So we also operate an out-of-hours service, so we support customers with their falls. If the ambulance response can take up to 9 hours, so we deploy staff to go and support those customers that may be laying on the floor. So we've bought a razor chair, which enables the staff member to be able to get the person up off the floor safely. And obviously that is really important for the customer's well-being. They're not left on the floor for 9 hours, and we're able to get them up and back to bed as quickly and as safely as possible. Our visiting service has been suspended, although we are calling and making contact with those customers on a regular basis. We've made over 1,500 calls to people in their 70s, and we're just about to launch 7,000 texts to our more general customers just to check in and see how they are and see if there's anything we can do to make life a little better during this time. We are still visiting schemes just to check on health and safety and compliance and making sure that the schemes are safe for people to occupy. We know that it's been really difficult for customers with not being able to access the communal lounges, and I have had calls to say, can we go in small groups if we safely distance and meet for a coffee in the lounge? But unfortunately, we've not been able to allow that to happen at the moment. But hopefully, as the vaccination is rolled out, we'll be able to open those scheme lounges once more. But I think making those phone calls on a regular basis, giving people the time to sort of talk and chat to us, and when necessary we've picked up emergency supplies and picked up prescriptions, has really helped customers' well-being. So I'm going to hand over to Drew now, who's going to talk about the broader NHS context and integrated care.
Thanks very much, Debbie. So good afternoon, everyone. I'm Andrew Van Dorn, the Chief Executive of HACT, and I'm going to talk a bit about kind of, well, where is the strategic environment now heading around the NHS and around integrated care. For the hour before I joined this webinar, I was in a weekly briefing that I have as a non-exec director in the NHS with the Chief Executive of my trust. And we talked about the things you'd expect us to talk about. We talked about vaccination. We talked about pressures in critical care. We talked about issues in A&E. And we talked about lots of workforce issues, but we spent 45 minutes of our briefing this week talking about well-being and talking about mental health of the staff in the trust. And so this is a really live issue for the NHS at the moment, not just how do we take care of our patients or our service users, but also how do we take care of the people that provide those services. And I don't think I've experienced ever actually a level of conversation that's taking place now about mental health. And I'm really delighted that that's taking place because it's something I feel really passionate about. So where is the NHS going to go from here? Well, we're hearing a lot now about vaccination. We're talking about the levels of kind of, or the prevalence of COVID coming down in the community, though it's still not coming down as far as people would like. Sorry, that's my phone. But we're also thank you. We're also talking about now where do we go after this period of crisis and into recovery. And I think it's fair to say that actually what lots of people are talking about now is that the kind of the direction of travel that was there before COVID hit us is very much the kind of the platform going forward. And therefore the long-term plan that was laid out by NHS England and the Department of Health actually is still very much the platform going forward, still needing to improve access for people, and still needing to really focus on the workforce issues, because the workforce issues that were there before COVID are still the workforce issues that we have today, which is actually significant vacancies and real challenges about how we grow that workforce going forward. For mental health, the issues are very much about new investments, and there's lots of new commitments that were made by government to put more resources into the mental health and community services in our community through the NHS. I think the other conversation that's taking place now is kind of what do we take from this period that we've done differently in the NHS and start to kind of embed that change going forward. And that's about digital working, that's about improving the, keeping that focus on mental health that we've had, and kind of embedding that further in the NHS, but also kind of the new relationships that have been developed over, and some of those relationships very quickly developed over the last kind of year, to make sure that we hold on to those and keep them moving forward. So the other thing that the NHS kind of laid down as the direction of travel was around integrated care systems. And I've been in this space of integrated health, housing, social care for most of my career. And I think that now we're having a very different conversation around integration. It's often felt in the past that we've had the rhetoric of integration rather than the reality of it. But I think that the direction of travel feels different. And it feels that actually the NHS is taking things a little bit more seriously now than it ever has around integration. And that is about improving population health. It's about kind of tackling kind of the challenge we have across the country about unequal outcome and access. And we've seen that come forward really starkly during the kind of the COVID pandemic period around health inequalities, the kind of the impact or the disproportionate impact it's had on people who are vulnerable and people who are from BME communities. But also, the broader issues there are good value for money and it is important, but also how does the NHS play its full role as part of the social and economic environment and future of our country. So let's just remind ourselves kind of what we mean by population health management. This is a really good kind of slide that can give a sense of what that's about. This is about kind of enhancing the experience of care, reducing the cost, improving health and well-being. But I think what's interesting is that now we're also talking about addressing health and care inequalities, which is something that we in housing care a lot about, but also about how we increase the well-being of our workforce. So integrated care systems have got a number of building blocks which are being put in, some of which have been in place for almost a year, and some of which are still kind of forming. So we've got the primary care networks, and this is very much a kind of network of GPs and community services at the kind of the very neighbourhood level, at the kind of the 30 to 50,000 population. Those primary care networks all came into being kind of last year, and they're a real fundamental building block of integrated care systems. We've then got what we call integrated care partnerships, and we're often seeing those emerge at the level of kind of a social care authority level, where it's a range of different providers coming together, NHS providers, social care providers, and housing providers coming together to kind of deliver integrated care at that level. And then we've got the integrated care systems, and the integrated care systems, what we perhaps used to call the STPs, we now call ICSs. They are operating at a much bigger geography, and they're taking overall responsibility for kind of health outcomes across a very large population, but also making sure that the long-term plan is being delivered. Where might this leave health and care commissions, you might ask? That's a good question. So they're kind of, we're seeing a massive kind of reconfiguration or merger of CCGs at the moment to one CCG per ICS, and we're seeing in the kind of the social care commission begin to interface there. That space is still kind of emerging, but it's certainly going to be a place which is fully integrated with the ICS, and very much people looking at population-based outcomes. Which I think when we think about healthcare outcomes and how we deliver that is something that where we in housing have a huge role to play. So the other thing to talk about is provider collaboratives, and this is something which has happened quite rapidly in some respects during the COVID period, but also was the groundwork to this was already happening before. And this is where providers of healthcare services are coming together either at the place-based level, or they're coming together at a more ICS level to look at how do you deliver a more integrated provider-led environment. And I think also for us in housing, that's a really important development, because actually as housing associations, we are providers. And when we interface successfully with healthcare providers and other social care providers, that's where we see some really, really good innovation. And that's where we see outcomes being able to be kind of addressed and tackled in a more concerted way. So let's have a think about the place-based partnerships. So this is about partnerships between sectors. I think there's a real emphasis at the moment for this not to just to be about the NHS talking to itself. And the NHS is very good at talking to itself. But actually it's encouraging the NHS to think about how it talks to housing and other voluntary and community sector partners. And in mental health in particular, there's a real drive to recognise and value the role of housing and VCSE organisations. And that's something that's really good to see, because we know that quite a lot of good mental health services are delivered outside of the NHS, in housing, in supported housing, in community investment, but also in the broader community sector as well. The primary care networks are looking to join up at the neighbourhood level around primary and community healthcare, but that's also beginning to interface with mental health as well. So we're seeing a lot of the mental health community services being talked about organising themselves at the primary care network level. And this means that the mental health trusts, who often work at a bigger geography, are looking at how do they make sure they configure mental health services at that very neighbourhood level. And for me, that's actually how do they join up with the work that we do in housing? Because actually we in housing will actually work at that neighbourhood level. That's our normal kind of location and our normal view at place. So there's a real opportunity to kind of engage there. But also I think there's something about how we all think about that question of kind of who is at risk, how we get to people quickly, how we support them effectively, and then also how do we contribute to broader economic development. I think if one thing we need to always remember is that good mental health comes about because people have good housing, have access to employment, and also have access to social networks and resources to be able to live successful lives. So what is the kind of the post-COVID response in mental health? I think first of all, as I've talked about, that population mental health piece is a really important driver at the moment. There's lots of conversations going on. And if you're not engaged in some of those at the local level, then I'd encourage you to get engaged in some of those conversations. It is about the provision of specialist housing. There's a real recognition that there are many groups of people who are in more restricted environments, be they in hospital care, particularly people with learning disability and autism, or people with complex mental health care, that actually specialist housing in the community is a viable and desirable alternative to being locked away in some respects for many years. There's lots of stuff around how do we create those kind of trauma-informed community-based well-being and empowerment programs. I think we've all got to think very carefully now about what it means to be trauma-informed. It's something that's that in our sector has emerged quite quickly in recent years in areas like homelessness and in kind of specialist mental health services. But I do think it's something that we need to think about here as well in the more general housing sense. As I said, employment support and employment services are critical. We don't need any more evidence about the relationship between people being in employment and having more positive mental health. And that is for people who've got long-term mental ill health conditions as much as anybody who experience more common mental health issues as well. So developing our workforce is important, supporting our workforce is important, partnerships to address inequality. And then I think the other thing to hold on to is this conversation which is now beginning to happen, which we call anchor to anchor conversations around local economic development. That's the NHS recognising that they are anchor institutions, and it's people like housing associations recognising that we are housing kind of institutions as well. When we bring anchors together at a place, then actually there is a significant amount of impact that we can make by working together and thinking about how we choose to use our resources in those places. So they're the opportunities I think for housing. I think there's some real opportunities around being that place-based partner, thinking about health and well-being of our workforce. Don't forget that within every housing association, if we are taking care of the mental well-being of our own staff, that is having a huge impact on health in our neighbourhoods. It's having a huge impact on the cost base of the NHS as well. So the more we do for our staff, the more benefits it has for the broader community and for the NHS as well. There's a real neighbourhood management piece here. Community investment is a really is an area that we forget about sometimes in housing, and it has a huge role to play in supporting people in the community. We've obviously got our care and support specialism, and I think there's a real desire to have more of that. But I think also we can be a social justice partner. I mean, we do care in housing around in health inequalities, and we do, you know, the response that we have in housing to kind of race equality, you know, we've got some way to go on that, but we can work with our partners in the NHS to look at that together. And together we can look at those kind of social and economic development as well. The final thing to not to forget is that in housing, we're asset managers. That's what we do. It's our day jobs. And in some respects, offering our expertise into the NHS can help that as well. So lots of ways in which we can engage, both as a specialist kind of mental health perspective, but also from a more general housing and health perspective. And I think the opportunities for us are really quite exciting as we go forward. If anyone's interested, we start on Monday a new development programme, which you'll be welcome to join up to as well. And I think I'll just hand over to Becky now for the questions.
I thank you, all the speakers there. Really loads of stuff to take away, loads of good examples. I think some of the key is good support for staff and customers, so good housing, good employment, good social interaction, all leads to good mental health, supporting mental health issues. I think, you know, that supported staff, better service delivery, benefits for the community, and also savings to the national NHS. I think it's a real time to harness partnership working and some of the progress that was made during the pandemic. So we do have some questions that have come through from the audience. So I'll start with Pippa. We've had a question from the Small Housing Association, and their board are keen to set up a wellbeing day for staff. They've got capacity issues, and they're wondering, are there any resources that they can kind of pick off the shelf that can be shared as well? And if anybody else on the panel has got any examples as well that we can take forward.
Hi, thank you. That's a really good question, isn't it? And the question about having the capacity to be able to do these wellbeing initiatives, I tapped into that when I was writing something at midnight and thought, hang on, this isn't right. We need to be thinking about all of our wellbeing. So yeah, there are loads and loads of places that you can go to. There are lots of really credible campaigns, and I would say a really good place to start is the Time to Change campaign. So I put the details on my presentation. I'm sure we can send them round, and they have loads of resources in there and toolkits and bits of information. And then there's all the charities like Minds, ones that are specifically focusing on mental health and mental well-being that I would start at. I think it can be really overwhelming, and certainly we found it. If you just Google, you will get thousands and millions of brilliant things, but start with a couple of things. We also looked at, the Public Health England have done psychological first aider training, and that's free. So we did that training. You can either do it over 4 weeks or it's just 4 hours, and you can decide whether that's something that you might want to roll out over your organisation. It's a bit like having mental health first aiders. I think there's a charge for doing that training, but the psychological first aid training is COVID related, and so maybe they're 3 good places to start. But your board might also want some outcome measures, and I think that's a really interesting discussion for us as a sector, is how do we monitor, manage the impact of these wellbeing strategies, and that's something that we're focusing on with our wellbeing manager. So if anyone's got any marvellous ideas, send them my way, but I'm happy to kind of talk and connect with people about things that we're doing.
Thank you, Pippa. Andrew, did you want to come in?
Yeah, I mean, I think this part of this is actually, how do we make these conversations normal? How do we get to the position where actually we don't have a wellbeing day? Actually, actually on an ongoing basis, we're just having conversations around people's wellbeing, be that our staff or be that the people who live in our homes. and actually we need to make them normal conversations, and that does for some people, can be quite scary. You know, actually it can be quite kind of an exposing experience to talk about yourselves. And I like what you're saying, Pip, about tomorrow. You know, have a conversation, be vulnerable, because actually when we're vulnerable with each other, it actually builds our strength, because we understand that together we all experience quite similar kind of feelings of maybe feelings of loss, feelings of nervousness, of anxiety, all of those kinds of things, which are quite normal. So I would say my plea to the kind of any organisation, regardless whether you're a small housing association or a large housing association, create the environment where the conversations can take place on an ongoing basis. Make sure that through line management, through supervision, these are normal conversations you're having. You know, if you want to have a wellbeing day, that's really brilliant, but don't end there. Make sure it's something that happens all the time. And actually, I think particularly people working kind of more general housing, you can borrow some of that expertise from your care and support staff, because actually these are conversations that do go on in a care and support setting and have been for a long time around reflective practice and things like that. So the expertise exists in our organisation. Sometimes we just have to go and find it and kind of use some of the really good stuff that we've been doing for some time in housing and making that something more mainstream.
Thank you. We've question about, so some of the strategies, and you probably answered a bit of this, but some of the strategies you've adopted specifically during the pandemic, are you planning to take them forward beyond the pandemic and beyond? Debbie, back in last year, is some of that stuff going to continue at Grand Union?
Yeah, I definitely think so. It's certainly made us stop and think, actually, how we're going to deliver our services moving forward. I think particularly around, you know, using digital platforms to have conversations with people. Obviously, there are people in our services that need that face-to-face contact, but there are others that don't. So definitely use the learning of the last year to think about how we deliver services. And I think as equipment moves to a digital platform, so your traditional ward and call systems and the telecare technology that we use currently is going to be a digital platform by 2023, then it's how we use that to support our customers, and then how customers can interact with each other with that equipment. So it will be transformational in the way that we deliver services, for sure.
Great, thank you. Is Drew or Pippa, is there anything you want to add to that in terms of strategies that you specifically adopted during the pandemic and that you think, well, great, we can move those forward?
I feel really delighted that we have a corporate commitment to, as you said, Drew, to embed well-being and these conversations that we've been having in care and support for many, many years, and can be frightening and daunting for our colleagues, maybe in property maintenance. And so absolutely, this is going to be rolled out as a corporate programme, and that it isn't tokenistic. You know, these things are healthy, normal, acceptable, deeply important conversations, that we have this kind of culture of compassion and culture of listening to each other, and also a culture of asking questions. So the campaign last year was ask somebody how they are, and then ask them again, because actually if you ask somebody twice, you're probably going to get the real response. If you ask someone once, oh yeah, I'm fine. So for us, definitely, this is a culture shift to make it okay to have those small conversations about mental health that have a big impact on ourselves, on our communities and our organisations.
Thank you.
I think following some of that up also with, you know, some work around kind of mental health first aid, for example, is a really good thing to look at for any organisation. It not only keeps your staff safe and well, but it also helps with their interaction with people who they're meeting, you know, people, tenants, people in community projects who are experiencing poor mental health as well. And you know, there's a lot of value in everyone having a core level of understanding and competency in some respects around mental health, so that some of those conversations then become less scary. Some of the experiences that we have of people who are quite stressed or anxious or depressed or whatever, actually we feel we're able to respond to that rather than run away from it because we're a bit scared about it. And, you know, and I think within any organisation, if you're working at, you know, as an end of service delivery, which is very much kind of specialist in kind of forensic mental health or something, you'll need a much more advanced understanding of mental health, but I think everyone can actually benefit from a basic awareness and understanding for just for how we live our lives every day.
Thank you. This is quite an interesting question. Have you found within your organisations, individual organisations, and maybe nationally, Drew, if there's been more pushback during the third lockdown as people become more sort of fatigued with the whole situation, perhaps losing a bit of hope, and some of the, particularly maybe with some of the wellbeing strategies, staff are saying, come on, it's too much, and they've pushed back and not engaged as much as maybe they did during last March, April?
People are tired, people are exhausted, and you know, as I spend most of my time focusing on care and support, and the third wave that we're experiencing has been far more exhausting, dramatic, chaotic, as we're trying to still respond to everything. So I think we are experiencing a completely different wave, and like I'd said at the beginning of a crisis, we're full of adrenaline, and that helps. There is a protective factor in stress. It's short-lived, and actually we're nearly a year on, and so from having these huge kind of hormonal shifts, these neurotransmitters battering us on the inside as well as the kind of external, so there is a difference. And so we need to be mindful as leaders and as organisations and as the sector to couch our communications perhaps in a different way, to understand that there is fatigue, people's kind of resilience is getting battered. We're all experiencing stuff in life, you know, death, divorce, all sorts of things. They don't stop. And then there's the COVID stuff. So I think it's really important that we have some compassion towards our colleagues. If they are kind of going, oh, that old thing, and it's not going to do anything, maybe that's their response because they're stressed. And how can we gently nudge in a different way? And certainly for us, and there's things about, you know, vaccine, so much fear and concern and question, lots of little nudge things that we can do as individuals and organisations. But I think we need to reflect on the different phases of the pandemic and how this impacts us individually, but as cohorts of teams.
Thanks, Pippa. Does anybody else want to?
I mean, completely agree with that. So I mean, so the conversations in NHS at the moment is about well-being. It is about kind of, as I said, it's everyone feels more prepared for this wave in the NHS, but everyone feels more tired. And I think also when we're feeling stressed and we're feeling tired, there are things we need to be aware of. So there is an increased risk of burnout for people. Actually stepping back and taking time out is really hard. It becomes harder actually, because you have, you know, to step away from something, you have both an emotional and a physical reaction to that. So when you don't have that adrenaline running, actually you can have, there's a sense of loss for that adrenaline in some respects, and you kind of want to find it, and therefore you kind of just keep pushing on and keep going. And I think there's some things that we have to be really aware of, and by having the kind of those conversations with each other, we can better understand that. I think for the NHS also, what really is of concern around mental health in particular is that the presentation of people who are really unwell is increasing, and it's at a time when the resources haven't quite come on stream yet within the NHS. I mean, there's a whole new investment in community services about to start happening from from April. There's been investment over the winter in kind of, particularly in some areas of housing, to help people get out of inpatient provision so they're not there. But actually, I think the conversation in the mental health sector part of the NHS is how do we respond to what they perceive to be a kind of a wave, almost a kind of coming at them of people who haven't quite managed to get the right kind of access to support during periods of lockdown, and actually that's just going to escalate as it goes forward. And I think that actually for us in housing, we've got some things we can do about that. We can work creatively with the NHS to help them with some of that, because actually where we don't want to be is a kind of experiencing some of the longer term kind of impacts of unresolved or unaddressed trauma that many people are going to start to experience.
Thanks, Drew. Just sort of thinking about housing associations and work with health, and thinking about, like, the first question was around someone with a smaller housing association with less capacity. How do you think those organisations are going to navigate some of those health partnerships at a local level? And is there any top tips? I know you've talked about your course that you're running, which is a nice plug, but
yes, I've got the alumni here as well on the course. So I would say that, okay, so for any housing association, you need to think about what are you, not just what resources you have, but whereabouts do you work? What is your kind of geographical perspective? For most smaller housing associations, they're quite place-based. You know, they work in one area of the country. They're not, most smaller housing associations are not spread out. Some of them are, but not all of them, but most of them aren't. Therefore, you can actually develop probably better relationships. The idea that, you know, housing sometimes gets themselves caught up in this idea that there's one NHS and one way of doing something, and we spend a lot of time in our programs helping people to unpick that and to realise that actually the NHS isn't a national thing. It's kind of a national brand, but actually it operates quite differently at the different place level, and therefore it's at that level where you've got relationships. You know, being a good partner isn't necessarily about providing services to the NHS. Being a good partner is about kind of recognising that you've got information, you've got insight that you might have about the people who live in your homes that could be really valuable to the local NHS, be they GP or primary care networks, or even at the local place level. You know, you might be doing some programs through a community investment mode that I can guarantee the NHS knows nothing about. How do you link those up to? How do you link up some of the things you provide to your tenants to the social prescribing kind of environment that's been emerging over the last year or so? So I think there is a lot of opportunity and it doesn't matter how big you are, there is still opportunity. The question is, how do you get into those conversations, and where do those conversations take place? And I think that I think that, you know, that's going to be different depending on what your offer is, but mostly, you know, there is connection that can be made. I'm also going to say you need to put some time into it, and you need to make some strategic choices. If you don't really want to get engaged with the NHS, you know what, that's fine. If you do, you've got to resource it. None of these relationships aren't built overnight, they're built over time, and just being committed to some of those relationships is important.
Do you think there's scope for sort of more consortium work between housing associations? So you talk about place where there might be a number of housing associations. Do you think it's beneficial for housing associations to come together? It might offer something different in the community.
I mean, yes, completely. Okay, so part of this is also how do we help the NHS make sense of us? If we think the NHS is confusing to us, when you go sit on the NHS side, they see us, they look at us and go, God, there's thousands of housing associations. I have no idea who I should talk to. Where do I start? So we've got to help them make sense of us. And actually, we can share and collaborate at a place level in a really effective way. And I think one thing that I take away from this past 10 months is that the appetite for collaboration at place between housing associations is something that I have never experienced. And it really does make my heart sing when I hear housing associations wanting to work more creatively with each other. It's kind of why HACT exists. It's what I do. It's my day job to help that happen. And I say yes, we should be doing more of that. And when we do more of that, we're more impactful.
I think just to add to what Drew was saying, I think it gets back, doesn't it, to the challenge of vulnerable leadership, because sometimes we can feel a bit, oh, that's what we're doing, and in the kind of commissioning landscape, it can be incredibly competitive, and so it can feel a bit scary, the thought of collaboration. But actually, there's real strength in just having that virtual cup of tea with, you know, somebody who's doing your role, and just having an honest conversation about what's going on, or who do you know who's doing this, that, and the other, and well, what meetings are you going to, and have that real honest, like, are you feeling all right about this? And there is a real kind of collective bravery, because, you know, we are going to see some tough decision making. we've seen some non-statutory cuts already come into play, which has had an impact on our mental health services. So now more than ever, we need to be really kind of shouting about the value of what we can deliver and the power and the knowledge that we have. And there is a real collective bravery if we do that together and not in our kind of siloed housing associations and organisations. So yeah, I think now is the time more than ever to be kind of coming together and working together.
Yeah. Is there anything you want to add? We've got a couple of minutes, Debbie, if there's anything you want to add around partnership working.
Yeah, I'd just like to add into that so I've just got a vacancy in our community investment team. So I've been having some early discussions with somebody who works across public health and housing in Bedfordshire. So we're looking at the role that I've currently got to actually become a health and housing coordinator, to start opening up those conversations so that we can do more of the stuff that Drew's been talking about. So I think we've got a fantastic opportunity to do something really different.
Oh, that sounds really good. I mean, we had someone who worked in Nottinghamshire that Pippa put us in touch with, who worked for a housing association that was seconded to public health. So those sort of examples are really positive moving. Okay, that's the end of the questions really. It's been fascinating. It's been a really positive session, and I think there's some really real opportunities moving forward. Yeah. Thank you all for your time. We might not have answered all the questions during the session, but we will try and pick some of those up. And like I say, there'll be a recording sent out to everybody who attended the session today. Hope you enjoyed it. And fill in there's a quick poll just popped up on my screen, so do fill that in. That's really good feedback for us, and it gives us tips for future webinars. Thank you, everybody.
Thank you.
Thank you.
Thank you.